This is Kim Newlove, host of the Pharmacist Voice podcast. Thank you for joining me for episode 89. If you're new to the show, welcome. I alternate solo shows and interview shows. The solo shows are about my career change from pharmacist to voice actor, and the interview shows feature a variety of people who use their voices to advocate, educate, or entertain. My website is thepharmacistvoice.com. Today's episode is an interview with Dr. Cory Jenks. He's a pharmacist, improv comedian, and public speaker. Cory earned his PharmD from the University of South Carolina in 2011. Then he completed a PGY1 residency at the Southern Arizona VA healthcare system in 2012. Currently, he practices as an ambulatory care clinical pharmacy specialist, where he applies his passion for lifestyle interventions in the management of chronic disease. Prior to that, Cory worked as a retail pharmacist, outpatient clinical pharmacist, and inpatient clinical pharmacist. Cory is also an accomplished improv comedian. He started his comedy journey in 2013. Since then, Cory has coached, taught, and performed improv for thousands of people. Today, Cory travels the country, or at least zooms around, teaching other healthcare professionals how to apply the valuable skills of improv comedy to create a more adaptable, empathetic, and humanizing healthcare experience. When he's not working or performing improv, Cory enjoys playing racquetball, basketball, and golf, exploring the science of disease management through lifestyle, and is currently earning his master's degree in dad jokes with the help of his two sons, Jacob and Henry. Without further ado, here's my conversation with Dr. Cory Jenks. Hi, Cory. Welcome to the Pharmacist Voice podcast.
Hi, good morning. Thanks for having me.
Glad to have you. This is going to be a fun one.
No pressure. We were going to have fun today. It will be a fun podcast. Yes.
You are required to have fun while listening to this podcast, dear listeners.
No chores or dishes allowed. You better be doing a fun activity.
That's right. Well, Cory, again, welcome to the show. Thanks for being with us. And can you tell me, how do you use your voice?
Okay, so as a pharmacist, my full-time voice is utilized in working in the world of ambulatory care. I have a really cool job where I have the unique ability to work under a scope of practice, a collaborative practice agreement, where I'm managing diabetes, hypertension, cholesterol, smoking cessation, a number of chronic disease states. And so on a day-to-day basis, I'm using my voice to try to improve the health of patients that I encounter with, whether it's medication adjustment or my personal preference, lifestyle management. It's the best medicine, but also laughter is also one of the best medicines too. So that's my full-time gig. You can find me doing that 40 hours a week, taking care of patients. But I also use my pharmacist voice to do improv comedy, which is, I know it's a very big stereotype, all the pharmacists that are so funny and do comedy, but I'm one of them. So I use my voice to do improv comedy to make people laugh when COVID is not happening and we're on stage. And also I use it to help other healthcare providers learn the skills of improv to become more adaptable, empathetic, and create a humanizing healthcare experience.
Well, today I want to focus on how you use your voice in the improv realm. And I'd love to hear, what problem does improv solve for healthcare?
Great. Well, I think that improv solves a number of problems. I think that improv, or in the healthcare experience, a lot of times we'll encounter healthcare providers that are very robotic, very unempathetic, very unable to adapt to an unforeseen circumstance. Now, of course, on the macro level, we're living in the COVID world, a very big unforeseen circumstance, and we're seeing ourselves do the best that we can to adapt. But it also means, how can we teach ourselves to be better adaptable to that individual patient in front of us that comes up with a question that you didn't learn in pharmacy school or wasn't on the board exam? Like, if I'm seeing them for diabetes and they ask me for a prostate exam, how do I respond? That's a true story. Your face says,
my gosh.
I didn't make that up. That happened. How do you respond in that situation in a way that is empathetic, that addresses their concern, but also moves the conversation forward and takes care of what they need done? And I think we, as a consumer and a provider of healthcare, I've encountered situations where people reading from a checkbox list or having the answer in their head before I even bring up my question can be really frustrating. And so helping to create ourselves in a more adaptable way, but also doing it in a way that kind of puts yourself in the patient's or provider's shoes when we're working with our colleagues to make that experience better. Because there's so much obviously we can't control in healthcare, but we can control how we respond and how we can create a better experience.
What I think of when I think of healthcare professionals interacting with patients is it can sometimes be boring and kind of lack empathy as a result. What's your solution, though? It sounds like you use improv, but are you trying to make people laugh? Or, I mean, what's the solution that you're proposing here?
So sometimes we want to make people laugh. So the solution is to really be able to live in the moment and to be better listeners, better communicators. Improv helps with this whole world of soft skills and listening, adaptability, teamwork. These are all soft skills that are really hard to measure. Like pharmacy, we do a phenomenal job of measuring hard skills. You get your degree, you take tests, you pass boards, you get certifications. We get all the letters after our name that say objectively we know our material. And I will say that being 10 years out of school and dealing with new students and residents, my goodness, you all are just whip smart. And so the challenge then becomes how can we take that knowledge and put it into a package that a patient understands, that a patient cares about, and that a patient will act on. And so, yeah, sometimes it means that you drop a little joke to disarm somebody and make them laugh. But it also can mean that sometimes they're having the worst day of their life and they need an arm around their shoulder. They need a pat on the back. I sound like my baseball coach. Sometimes you need a kick in the ears. Sometimes you need but really learning how to know how to respond emotionally. And so people, when they hear I do improv and that I'm a pharmacist, they say, oh, it must be like Patch Adams where you're just making people laugh all the time. And sometimes that's a joke is not okay or appropriate, and it's not what a patient needs. And so it's not just the funny part, it's knowing the spectrum of emotional responses to have.
What's the yes and part of doing improv in healthcare?
Taking a step back, yes, and if you learn nothing from this podcast, is that this is the two words that form the basis of improv comedy. Yes, and means to agree and build together. So, for example, in an improv scene, if someone says to me, we're on the moon, I would say yes. And we only have 30 seconds of oxygen left. So I've agreed to the reality and built something on top of that. Now, if they say we're on the moon, I'd say, no, we're in a bounce house. Well, I've completely negated their reality. And we've had to spend all this time rebuilding our world and justifying why I thought we were on the moon. And so how we use this in healthcare is to form sort of a life philosophy is really how I see it. Because when we say yes, we agree to the reality before us. Now, I hear the pharmacists out there screaming at me, Cory, you literally say yes to if someone asks for 1,000 Percocet. Well, no, we can't literally yes and everything all the time. But what I would argue is that I'll counter for the question is what is the default world of healthcare? I would argue it's most often a no. Can I get this drug covered? No. Can I get some more time with my patients? No. And the morbid joke, will I live? No, right? We have too many no's in healthcare. But if we could at least agree to listen to the idea in front of us, I think that our experience would be much more pleasant. So that patient that asked for 1,000 Percocet, we can yes and where they're coming from, because if we simply ignore them and say you're a bad person asking for too many controlled substances, we're not going to solve the problem. But what are they trying to tell me when they ask for that? What is their reality? And the reality is they probably have a big problem. How can we fix that? How can we solve that problem? And I'll say that when we start to say yes in our lives and in healthcare, we just live happier, bigger lives. We find reasons to help someone in our setting instead of reasons to ignore and not help them. And I think we've probably all unfortunately been on the side of the equation in healthcare where we've been no'd and said we can't have that happen. And it creates a terrible experience. And so this idea in healthcare of improv is a team sport and healthcare is a team sport. So we agree and build together in the service of our patients.
Yeah, well, it sounds like what improv does is helps them feel seen, heard, understood, and cared for in the way that they need to be cared for. They feel satisfied, right?
Yeah, I think that's one of the biggest pieces of feedback that I'll get from patients. And then my wife's a nurse practitioner. She's also been through improv classes. And we both lament working in chronic disease that we don't often totally fix the health problems before us. But our patients are very satisfied with the experience. Of course, like we do the appropriate measures to try to help them. But the feedback from our patients is, you listened. You're the only one who listened to me. My doctor doesn't listen to me. My nurse doesn't listen to me. You're the only one that listens to me. And sometimes we just have these conversations at dinner like, I don't know if I did a lot with the medication changes today, but my patients needed that phone call. They needed to have that, at least somebody that cares for them, or at least seems to care for them. And so, exactly right. Having our patients listen to. And then as other healthcare providers, like pharmacists, we kind of have our own little battles to fight in getting provider status, or what I do is very unique in disease state management. Getting buy-in from other healthcare providers, a little yes and from other people that we work with, we would go a long way to making our jobs more satisfying too.
Well, it sounds like improv can help with more than just the pharmacist patient experience. It can help with relating to coworkers or people that you don't even work with that you need to call, for example, a doctor to
Mhm.
change something or an insurance company.
Yeah, definitely. And I think this idea of yes and is really great in those situations, because when you call an insurance company, you're calling a physician's office. They're stressed, they're busy, you're stressed, you're busy. And it's very easy to devolve into kind of fighting each other. And this idea of agreement, what I find is, for conflict resolution or for being frustrated with each other, instead of fighting each other, I agree with them. I'll call and say, "This is ridiculous. I can't believe you're having to call us." And I'll say, "Yes, it is ridiculous, and I wish I didn't have to do this conversation, but let's try to find a solution together so that we can get on with our days, take care of the patient, and move on." Instead of trying to fight it, I get agreement that, like, we're all kind of fighting the man. I'm using quotations for all of the audio listeners out there. Like, the man of healthcare can be really frustrating. The system can be really frustrating, and no one gets up to, like, say, "I'm going to ruin this pharmacist day," or "I'm going to ruin this doctor's day." We got up to try to help a patient, and when we can agree that this is a ridiculous system we're trying to navigate, let's try to navigate this thing together the best we can. It kind of brightens the day of the person at the other end of the line, instead of just saying, "I need that prior auth right now." I know it's a lot of hoops to jump through. They really could use this med. Thanks for helping me out. I know you're busy. And so just that empathy piece too, really, really draws it all together.
I feel like what you're doing with improv and the exact example you used just now is you're giving people the words. I know that improv is all about being unscripted, but just having the experience of hearing another way that it can be done can actually show somebody exactly the other way to do it.
Yeah, I think that you get into the healthcare ecosystem, and I've been doing this a decade now, and it can be frustrating and kind of drive you down. And so when you can get I'll use a little pun here, if you can get a different voice of how things can be done or how to approach a problem, it can be really refreshing. Now, the caveat to that is, you got to have that yes and mindset to say, "Oh, that's an interesting different voice or a different way of doing it. Maybe we can try that approach." And unfortunately, I think still we come up with a lot of people who are very kind of set in their silo, set in their way, and that's, I mean, that's the fun challenge of what I'm trying to do, is build something where we can create a more enjoyable experience for our patients, and those of us who are working so hard to take care of them.
How does the patient feel after the improv based interaction or the insurance provider or the doctor you just called? I mean, it sounds like it's supposed to be enjoyable for them. So I guess the question really is it enjoyable then for the pharmacist and whoever they're talking to? I mean, who's supposed to benefit from this interaction using improv? The pharmacist, the person on the other end, both?
I would say both. I think that in a perfect world, we're going to have an interaction where the patient feels listened to, as you so well put, and we find a solution for their problem. As the provider, as the pharmacist who's doing the improvs with them, I'm going to feel satisfied because I got into this business to take care of people, and when I can leave that interaction with them satisfied, happy, and then most importantly, with improv, we have very specific communication. That's one of the big pieces that we want to focus on. is that we've appropriately set them on the right path to where they're going. And what I'll say about the improvised interaction is improv has rules. Like you heard the first one, yes, and we don't need to go into all of the specifics of them. We can get into as many as we want. But my parents are just blown away that like I go and rehearse and practice these rules. They're like, it's all made up. Well, we have these kind of guidelines and rules, but with them anything can happen. Well, healthcare is a pretty cool parallel. Is that we have rules, we have HIPAA laws, we have DEA rules, we have our whatever it is, my scope of practice. We have these rules. We have a set time frame. But within them, every patient interaction is going to be different. So it's everything is improvised. To every pharmacist listening or every other healthcare professional listening, you do improv every time you talk with your patient. It's just how well do you do it and how well do you navigate it and how well are the outcomes. And what I'm trying to do is give you the skills to do that better and more effectively so that you do have a more enjoyable experience and the outcomes improve.
When I was in level 1 improv, the 3 rules we had were love, truth, and play.
Mhm.
And I think part of what I hear you saying is that, yeah, there are rules, but you're trying to get one another to see the same truth.
Mhm.
Do you see what I see? And can we move forward to help the patient based
Mhm.
on this? We're not trying to butt heads. We're trying to see the same thing and
Mhm.
get the best result for this third person here, right?
Yeah. Well, I might steal your level 1 a curriculum there. Love, truth, and play. I love that because with improv, there are no mistakes. There are only gifts. Since there are no scripts, whatever happens to us, we can choose to turn into a gift. And so with our patients, whether it's a patient who is seeing me for diabetes and asking me for a prostate exam, I could love that interaction of trying to have some fun with it. I get to the truth of like their reality in that moment is they don't care about their blood sugar. They care about this exam to get another medicine and then play like, okay, how can I turn this into a situation whereas rather instead of getting my mouth dry and my heart rate going, I can sit back, relax, and say, all right, we're going to have some fun and we're going to get to the end of it. And so that truth part of the equation, one of the baseline books of improv is called Truth and Comedy. And some of the best comedy that we have in the world are just absurd truths that we heighten. So Seinfeld's a beautiful example, a show about nothing. It's all these just mundane things that happen, but they're all based in reality. And you could say right now with our patients, you're trying to find what is their truth. We're in the middle of the COVID pandemic. If you're listening to this in a decade, I hope things turned around. We're turning around here in March of 2021. But for like patients that don't want to get a vaccine, well, we could butt heads and say, no, 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 I'm the professional. You needed your vaccine. Or we can meet them at their truth. Why do they think that? Why are they hesitant? And empathize with them because we're all very easily manipulated as much as we don't want to believe it. Whether it's checking our Facebooks, drinking our coffee, it's very easy to get into a mindset. And so I find that when I'm having those conversations with patients and they say, I absolutely don't want to get it, I'll say, yes, I can totally see why you would say that. And for patients who are like, I need it yesterday, I say, yes, and I totally see why you would want it. And so, and in that way, instead of butting heads, we're trying to find some trust and truth to eventually get to the outcome that we're looking for.
What I want to do next is run some situations by you. These are situations that pharmacists encounter, usually in the community setting, but maybe I'll throw in a fourth one
Okay.
that has to do with just working in a hospital.
Hmm.
Okay, example number 1. Say there's a patient, and you, as the pharmacist, have to say, this isn't covered by your insurance. I'm sorry.
Hmm.
And the patient gets upset and says, what do you mean? My copay is supposed to be $5. What do you say?
All right. So what I would say is, I would be upset as well. The insurance companies make this incredibly challenging, and you are just one of many patients that I've had today who have had an issue with their copay, had a problem with what their cost is. And I am very sorry that what you were expecting is not what the cost is. And so, what we can do is try to work together to find a solution, whether it is a discount card, whether it is an alternative medication, or whether it is a totally different approach that we need to find if this medicine is even the most necessary medicine that you need. We could find an alternative. But I assure you that your frustration is just one of the many frustrations I share on a day-to-day basis, and I want to try to make this as right as possible for you with what we can control.
Thank you, Mr. Pharmacist. You're awesome.
Oh my goodness, I fixed it. Yay. That's how and that's to all the community pharmacists. That's exactly how it goes, right? Yeah.
Oh, we wish.
Yeah.
I worked community practice for many years, and yeah, that is a common problem, isn't it?
Yeah. And in that situation, my whole goal is to find that shared empathy of like we deal with it as the pharmacist on the other side of it, like trying to run these prior auths and the insurance changes. And gosh, New Year's Day is the worst day of the year, right? Everyone's
New
deductibles
insurance
reset,
cards?
new insurance cards. So yeah, it's and I know we improvised it here, and of course when you have 5 cars deep and 10 people deep in line, it's not as easy. But I hope we're able to see the thought process there at least.
Right. Well, and sometimes problems have layers. I
Hmm.
started off with layer number one. I'm going to hit you with layer number two.
Okay.
You proposed, let's call the prescriber, see if we can work something out.
Hmm.
You tell the patient that, and they say, I don't want to wait. I waited for 5 cars in front of me or 10 people in front of me at the pharmacy. I don't want to wait anymore. What are you going to do for me? Come on, Mr. Pharmacist.
I can tell there are, yes, you have waited a long time to get this done. And what I'll tell you is if we can wait a little bit longer, we might be able to save you a lot of money. And so this 10-minute phone call could be worth hundreds of dollars. So on a per hour basis, you're going to be making out pretty good if we can make this happen right. And again, I wish we could have headed this problem off minutes, hours before, but this is simply the reality that we are presented with. And I need to make this right for you, and it will take time to get it right. And so, if you like to wait here, you may. If you will have some other errands to run, that might be a good option too. So, if you want to go take care of that, when you come back, I will make sure we give you a fast pass to the front of the line. When I see you come in, I will call you over and I will give you the information directly to you so that you don't have to wait because you have indeed waited plenty of time to get your solution, which we haven't yet provided.
Oh, thank you, Mr. Pharmacist. My anxiety level just went down so much.
Oh wow, you don't need that. You don't need that medicine now. Awesome.
Okay, now let's say this is Kim talking again.
Yeah.
Let's say the prescriber changes it to something else that's
Hmm.
out of stock. Another
Okay.
common problem in community practice.
Yeah.
Now the patient is upset. First, it wasn't covered by the insurance. Now you had to talk to my doctor. Then they changed it to something that you don't have. What are you going to do for me now?
Well, first, I will again apologize. Nothing could have gone more worse today than it already has. And I want to do everything I can to make this right. So we have a series of other stores within 2 miles of here. I can call to see if they have it. And if they do, I will make sure that it is transferred over there and filled while I am on the phone so that you can go over there and pick it up right away. If that is not an option, we can work on maybe getting a courier to bring it to your house. What else could I do to take care of this for you? Because this is absolutely been a series of unforeseen circumstances that have put you at the bottom of the barrel for good luck today. And short of me magically making it appear here in the pharmacy, would sending it to a location within a mile or two, I will send it to a competitor. I do not care as long as you get what you need today.
Oh, thank you, Mr. Pharmacist. I feel seen, heard, and understood.
Yes. Oh my goodness. Thank you so much for understanding my plight as a pharmacist. Now, please, I have 1,000 prescriptions to check.
I
Yeah.
know we wouldn't say that to a patient, but
Yeah.
that was a good example. You navigated it well. I think in any of those instances, you gave them plenty of information so that they felt seen, heard, and understood and cared for. Like you
Mhm.
were going to see this through until the medication comes to the pharmacy and into their hands.
Yes. Yeah. And sometimes that's just what it takes. So you had asked earlier, like, so do you just like make them laugh? Like, this is a situation, these 3 scenarios are certainly not ones where you can just like laugh it off because they're, to this patient, it's no laughing matter. It's the most important thing that in their lives in that moment. And for me, I like to use this idea of evidence against one's own best interest. So in that last scenario, I will send you to a competitor. I will have spent 4 hours getting this ready and make $0 if that is what will make you happy today, if you can get your prescription. Like, to me, what more can I tell a patient other that how much I care about them? Like, in a world where we lament the massive profits of healthcare and salaries and this and that. If I'm willing to sacrifice all of the time and money I would have made off this prescription to take care of you, then as a pharmacist, I feel like I've done everything I could, and I can sleep well knowing that if this patient is still angry, then that is ultimately their choice at this point, because there's just no more reasonable steps that I could have taken.
Now, there's a lot of really dry, boring ways that people could have just delivered that information. What I heard from you was a lot more interactive talk. We
Mhm,
can do this or we can do that.
mhm.
And I think ultimately the patient likes knowing they have options. How frustrating is it to know that you have no options?
Yeah, I think that's one of the biggest dissatisfiers in healthcare is you run out, you're told, like, this is what you must do. You can have this procedure or this procedure. Or for my pharmacists that work in the inpatient side of the world, like, you can get your medicines administered at 7 o'clock or 7 o'clock. Well, I take my medicines at 9 o'clock at home. Well, the nurses give them at 7. That's when you get them. And it's like 1,000 little pinpricks that lead to such a big dissatisfaction with the whole healthcare experience. Like, and I understand from a healthcare side, we have our certain procedures we have to follow to take care of our patients, but being unwilling to bend at any point to provide a little bit of satisfaction and a little bit of, like, being seen, heard, and understood, as you say, it just goes such a long way.
Yeah, that whole seen, heard, and understood is empathy. I mean, really, they trust us because we have the credentials, the coat, the ID badge. But really, we have to express that empathy to get them to relate to us, I guess. And
Mhm.
relating to people is very important. And I think that you can be a more effective pharmacist when you can relate to people. So I didn't have these improv skills until I went into the voiceover industry and I
Mhm.
understood I needed to get better vocal variety because
Mhm.
I was the soccer mom that, I coached soccer literally for one of my younger kids. And I helped my older son who has autism with his therapies and whatnot. And, I had my specific skill sets, but improv helps you reach into different areas to be able to deliver bad news better
Mhm.
or to deliver good news maybe in a different way that's not
Better.
well, I know, like, that's not over the top, I
Yeah.
guess, just to get it done and move on.
Mhm.
Now, one of the things that I remember being in a community practice setting was having, for lack of a better term, a chatty Cathy.
Mhm.
You develop relationships with patients over time. You go from filling somebody's bubblegum flavored antibiotics to filling their birth control pills, and then, oh, they're older, and now you're filling their prenatal vitamins or their kids are getting antibiotics.
Mhm.
I've had those experiences where I've experienced the spectrum and they want to talk to you.
Mhm.
How can improv help with chatty Cathys?
Yes. Oh, the old Chatty Cathy, or the Gabby Gary, for the other other spectrum there. But yeah, I think improv is very useful for all of those for those situations, because again, we want to meet them on their reality. We want to agree, like, they're excited to see you. You've done a great job because you've got someone that cares about you as a human and not just seeing you as a pill dispenser or adjuster of diabetes medications. And so I want to accept their reality, but also acknowledge my own reality. And what I typically will do, because I get so many minutes for my phone appointment slots or face to face appointment slots, is if they start chatting, I'll say, "Mrs. Chatty Cathy, I am so excited to hear all of the things going on in your life, and I would love to hear everything that's happening. I have a minute to listen to what's going on, but there are 4 people behind you, and they are just as chatty and itchy to get their medication and say hi, and I wouldn't be doing them a service if I didn't allow them the time that they deserve. So tell me the big highlights of your life right now, and the next time you come in on a Sunday when it's a little less busy. I want to catch up with you and know everything that's going on. But and I'll even acknowledge, and I'll say, I don't want you to feel like I'm ignoring you, but I have a lot of other things going on. Or I'll say, I have a patient I got to call in 2 minutes. Is there anything else related to your health condition that I can answer for you in the last minute here?" So I acknowledge that they're chatting and that they want to chat, and I acknowledge I enjoy it. And I'll say, I really love our conversations, but I got another patient behind you, and they deserve all of me as much as I'm giving to you right now. And so I hope you don't take this personally. Please don't take it as an offense, but I need to get on with what I'm doing with my next patient. I can't wait to see you the next time you come in and I hear all about your grandkids or whatever it is. So
Hmm. Oh, lots of good options there. Very
yeah.
good. Now, one of the things that I learned in improv, and again, I've only had level one, I'm probably not as advanced as you by any means, but one of the things that I learned was that you're not supposed to talk about what you're saying while you're saying it. For
Hmm.
example, I was in a situation on stage with a guy named Leo,
Hmm.
and we were conjoined twins,
Hmm.
and we had to go about our business. And the teacher of the improv class said something about, okay, you guys need to take out the trash.
Hmm.
And we had to put our arms around each other and walk around and try to get the trash out. It was pretend trash, of course.
Hmm.
So that's
Yeah.
problem number one, a little bit tough. We didn't know what to do because we were new at this. And we started talking about being conjoined twins. Like, why did mom and dad never have us separated? This would be so much easier if I had two arms and not your left arm and my right arm or something.
Hmm.
And the instructor stopped us and said, hey, hold on. We don't talk about it while we're doing it.
Hmm.
Right. So that is, I think, an important rule of improv that you could probably speak to. Don't talk about it while you're doing it. Just deliver the information without talking about it.
Yeah. So for all the people out there who've ever made a peanut butter and jelly sandwich, I guarantee you don't say, I'm going to the cabinet. I'm getting my bread out. I'm opening my jar of peanut butter. I'm spreading my peanut butter. Because improv is really about relationships. The whole crux of what's happening is what is the relationship between these two, three, four people in a scene. But the thing is, in our daily lives, we don't just sit there as talking heads and talk to each other. So what I say is we have this rich background, this rich environment that we live in, and so as we're making the sandwich, we're talking about our day, we're talking to our kids, and so that provides a window into as an audience member from an improv world of they're making dinner. This is the environment that they're in, and it also I find as an improviser, if I'm not just standing there talking, I have more ideas that come to me. A lot of times we get stuck in our own heads, and this can be improv. This could be working with a patient. This could be just your life. When you're just sitting and thinking so hard about what to say, it doesn't really work as well versus like going for a walk or doing a physical activity that sort of gets you out of your own head is what I'm trying to say. You can get out of your own head. And so like because I'll take blood pressures on patients, I'll be going through their notes. And so as I'm like looking through their blood sugars or looking through a log or something, I won't be saying, here, your blood sugar was 123. Oh, how are the grandkids? Or how's your garden doing? Or did you see the game last Sunday? And so I'm distracting them, not distracting them, but just talking to them as human beings and not just as blood sugar numbers or blood pressure numbers. And then by the end, I've done all the things I need to do from a pharmacist perspective. And we've had a lovely conversation. So we get that human side of it. And I've done the tasks I need.
Cory, can you tell me about your business?
Yeah. Oh, like my personal bit. Oh, my improv business. Okay.
Tell me
Thank you.
about your improv business. I've been to your
Okay.
website, coryjenks.com, and it
Yeah.
seems like you have two services on there. Hope correct me if I'm wrong, but it was public speaking and workshops. Is that right?
That's pretty much, yeah, where I'm at right now. So I have a couple of talks. So for those out in the world looking for an inspirational improv based keynote address, I do talks. But I would say that my favorite activity or my favorite service are the workshops because the talks, I'm talking to a crowd. It's a lot of fun. But the workshops are where we get people to start getting hands on. And I get other pharmacists, nurses, healthcare professionals, anyone in that spectrum doing the improv games, practicing it, feeling it, and breaking down why it's such a useful tool. And so I hope as you've been listening today, you've been thinking, oh, wow, that seems like a lot of fun. But how do we apply it? And so that's what I do with these workshops. And what I try to do, I am a pharmacist, so we all like to practice evidence-based medicine. So I practice evidence-based comedy. And so all of my talks are based in medical literature, showing the utility of role play and improv in making us better communicators, better empathizers. And so depending on the different workshop or talk, I'll go into different levels of that information. But the best part that people love the most is when they get to play. And what I see is what I create really is an environment that pharmacists can experiment and try new things in a zero gravity, zero consequence environment. So I've worked with a lot of students, and students understandably are very concerned about outcomes, grades, things of that nature. And when I work with them, I say, this is not graded. There are no wrong answers. And I was like, oh God, no wrong answers. Thank you. So you can go and do that, because pharmacists, we're high stakes. We can't be wrong. But if we can never be wrong, how can we try new things, practice these skills, practice the empathy, uh, versus the on the job training, where if you like, I'm going to try to make a joke here and someone's wildly offended, then oh my gosh, I've lost their trust, versus I'm going to say something non-funny in an improv scene and the consequence is nothing and we'll move on and never speak of it again. And so yeah, and I've actually kind of a new piece of the non-listed puzzle yet. I've got it into consulting as well, trying to implement some improv curriculum into other healthcare schools. And so, like, I'm in Tucson. This predates me, but they do improv in their pharmacy curriculum, which is awesome. I've helped out quite a bit with that.
Cool.
My goal is to bring this message to as many healthcare professional trainings and students and professionals as possible. So yeah, I speak and I do workshops. I'll help you implement a curriculum. And if it's not listed on there, ask me and I'll yes and we'll find a way to work together and get some yes and in your life.
Hey, you talked about the games and activities. I gotta say,
Mhm.
I had so much fun in improv. I don't think
Mhm.
I ever laughed that hard as an adult. I mean,
Mhm.
there was some kind of naughty stuff that went on too. Just like people's minds go to places you don't expect, and you're working with all kinds of people from different walks of life. They could be
Mhm.
students or young
Mhm.
adults, and they think about what they think about and they share it, and there's no filter. Improv class is fun. Those games and activities are fantastic. So I got to say,
Yeah,
as a fellow pharmacist who's done improv, if nothing else, you will have fun.
right. And that's, I think, the front sell on this is it's a great way to learn soft skills, adaptability, and teamwork. And the feedback I get on the backside of what I do is that, wow, that was a lot of fun. That was very different. We needed something different. And so when I'm trying to pitch this idea to someone, well, it's something different and fun. Like, I know that, but that's not usually enough to like get someone to convince them to hire me to speak or do a workshop. But on the backside of this, and for anyone listening who might be interested, like, it is something fun and different. And one of the things I'm really struck by is we have students, professionals trying new things, getting outside their comfort zone. And I've been doing this virtually because of COVID. I see this screen of smiling faces. They're trying new things, they're outside their comfort zone, and they're happy. And when's the last time that you were trying something new that was challenging yourself and you were smiling and happy? And that's what I love the most about it, is that on a healthcare basis, we have hard jobs. COVID has made our jobs infinitely harder. It's sad. It can be depressing. It can be really beat you down. So at worst, you're going to have a moment of levity and fun. And at best, you're going to learn some really useful skills while also having a lot of levity and fun.
I totally agree that improv can be applied to the pharmacy profession, nursing, medicine in general. I
Mhm.
think it is, like you said, a lot of fun to play these games. But to
Mhm.
even apply it to what we do day in and day out, I think you need somebody like you, Cory, who is both a pharmacist and an improvisation specialist, and to show people how you can have fun and you can also apply it to your daily job, which is sometimes boring and, like you said, robotic.
Yeah, well, and to life. I think improv, as I've had time to really focus in on my improv career, because I've been doing improv for 8 years, and I knew I wasn't going to go pro onto like Saturday Night Live. I got two kids here, so I wasn't going to leave Tucson. But how can I take this skill set to another level? And I just realized, oh, I can combine it with what I've already been doing as a pharmacist. And really, I've had so much fun seeing light bulbs go off, seeing aha moments, getting the feedback that that was the most fun CE I've ever done. Because I get these accredited, by the way, for those of you curious. Get that CE credit doing improv. It's the best CE credit you'll ever get. But hearing the feedback, like, that was the most fun CE you've ever done. I haven't thought about things this way. I can apply this, right? I want to have fun, but if I'm not solving the problem as you asked at the beginning, then what the heck am I doing? And I think I do a great job of applying and helping people solve those problems.
I wish I could see more videos of you doing this with pharmacists. I think
Mhm.
a lot of other pharmacists who are kind of improv curious would appreciate seeing what it looks like. Because wouldn't
Mhm.
it be fun if we could talk about these common issues that we have with our patients in
Mhm.
in a no pressure setting like improv and just
Mhm.
talk about what would you say? What would you say? And just everybody go around the room and talk about what they would say. And you can't be wrong. The patient's not there, and you get to hear how other people do it and what works
Mhm.
for them. That would be so nice because networking can only go so far. You have to be careful what you're saying,
Yeah.
but you throw in improv and magically people are like, "Oh, this is supposed to be fun. It's okay."
Yeah, and I really love your thought of getting a group together and sharing those ideas in a zero judgment environment. Improv, when you're practicing this, you're trying a new skill. You shouldn't be. You should try to get rid of that part that judges yourself. And getting into a meta level of improv is a team sport. Well, healthcare is a team sport. We need to support each other, and I think sometimes we get into our healthcare silos. Even within pharmacy, we get into our I do community, I do hospital, I do AmCare, I do this, I do that. But we're all in this thing together. Healthcare is not enough. It's too hard for like one person or one profession or one section of a profession to fix. I think getting the variety of backgrounds, experiences, and ways of dealing with things is great. Like your role play with me, I gave some suggestions of how I'd apply it. If you got 10 other pharmacists, I bet you they'd have 10 great ideas of how they would do it. And improv is just sort of a conduit to getting to those solutions.
Well, Corey, if anyone wants to work with you for curriculum development, public speaking, or the workshops, how can they get in touch with you?
Well, you can go to my website, CoryJenks.com. That's CORY. My parents were cheap. They didn't buy a vowel and get the E in
Oh,
there. A
jeez.
little Wheel of Fortune joke for you out there. Anyone who's listening enjoys Wheel of Fortune. Uh, you can find me on LinkedIn. I stay pretty active there professionally, trying to network. And I have some social media that I don't do a lot of posting to: Instagram, Twitter, Facebook. LinkedIn and the website are the best way. You can also email at Cory@improvrx.com to get a hold of me there. It's the beauty of 2021. There's a million ways to flag me down. And I really appreciate the time today. I know that we're running short on it, and I could talk about this for hours and hours. So for those of you out there who want to talk about it for hours and hours, and maybe have me work with your team, let me know. I could yeah, I will stop babbling about it and let you talk to me about it another time. But thank you so much for the opportunity. This was super fun.
Oh, it's my pleasure, really. I am an Ohio pharmacist, and I am going to recommend this to the Ohio Pharmacists Association for you to be a speaker. I think we're doing virtual conferences, and I'm sure they've booked up the annual conference for April already. But I could see you doing this since we're doing virtual conferences a lot during COVID. And I would love to see more of you and, have you do your thing professionally for a whole entire hour, during one of
Yeah,
these conferences. As much as
yeah,
I know about improv, I can certainly learn more, and I plan to learn more once the world opens back up, Corey. My gosh,
yeah.
when's
I
that gonna
know. Well,
happen?
Well, our local theater has started some face-to-face classes. So if you wanted to
Oh,
relocate to Tucson for improv classes, which I don't recommend unless it's not the summertime, it's too hot here in the summer. But yeah, I would be honored for, and I've done this for my state association in Arizona as well. So I do have that experience for the event planners out there. But yeah, I love every opportunity to sort of spread the word and bring a little levity, fun, and utility using improv to healthcare.
awesome. Well, thank you again so much for being on the Pharmacist Voice podcast. This has been a fun one. Thank you so much.
All right, bye bye. Take care.
Thank you for listening to episode 89 of the Pharmacist Voice podcast. Please visit thepharmacistvoice.com to subscribe and read the show notes.